gave me long life.
Teşekkür.
谢谢。
Dhanyavad. Me quitaste mi dolor de mi corazón.
Köszönöm az éveket a családommal.
Thank you. You saved my life.
Ladies and gentlemen, the President of the European Society of Cardiology, Professor Barbara Casadei.
Thank you. That is a simple phrase that means so much, whether it comes from your patients, from your junior colleagues, from your senior colleagues, or in this case, from your professional society, welcoming your support and participation here in Paris. By being here, you demonstrate your enthusiasm for wanting to be at the forefront of cardiovascular science, for providing your patients with the best possible care. So on behalf of all of us at the ESC, do allow me to extend our most heartfelt thanks to you. It is here on occasion like this that we can reflect on what we have achieved and how far we've come. And we have so much to be proud of. Through extraordinary progress in discovery, innovation, and implementation, we have contributed to producing spectacular reductions in cardiovascular death. Just look at this graph and the decline in mortality rates in Western Europe since 1980. This is an amazing achievement that happened in my lifetime and inspired me to become a cardiologist. Indeed, since my day at medical schools, there has been unimaginable progress in the fight against cardiovascular disease. From thrombolysis to primary PCI, from effective LDL lowering to prevention of sudden death, treatment for heart failure, valvular disease. As you can see, the way we have been practicing cardiology has been radically transformed every 10 years. Now we have so much more to offer to our patients, both to save lives and to improve the quality of life. Yet, so much remains to be done. Cardiovascular disease is still the #1 killer in the world. In Europe, more people die each year from cardiovascular disease than from any other cause. More than 30% of all deaths. The vast majority is still due to ischemic heart disease and stroke. And perhaps the most striking and unexpected statistics, more than 3/4 of cardiovascular deaths today take place in low and middle-income countries. We know a lot about the causes of heart disease, and we have evidence-based treatment at our disposal. That is a privilege, but knowing is not enough. We must apply what we know, and we must fight the hidden enemies of complacency and disinformation, which prevent medical advances for reaching those most in need. Tragically, millions of people still have limited access to adequate health care around the world and in Europe. And millions still have their lives destroyed by heart disease. And as for cardiovascular risk factors, the battle is not over. tobacco remains a major problem. It still kills more than 8 million people a year. And yes, we have made some progress in part of Europe and in the US, but look beyond. About 80% of the 1.1 billion smokers worldwide now live in low and middle income countries. Obesity is on the rise, particularly in younger generation, and with it, growing rates of diabetes and hypertension. Also, let's not forget that many inherited and acquired forms of cardiovascular disease still have no effective treatment. In some countries, economical and political forces have turned a blind eye to inequalities and extremes in healthcare provision, and funding for research and drug development for cardiovascular disease is no longer a priority. Here is the number of cardiovascular drugs approved in Europe in 2017 compared with those for cancer. And here are the number of cardiovascular drugs that entered investigation in 2018. As you can see, the pipeline is drying. Why? Because payers, industry, and politicians have been conditioned to believe that the hope of a large gain for a handful of patients is more exciting than a moderate benefit for millions of people with cardiovascular disease. But this is not right. And unfortunately, these are not just empty fears. Together, these trends have a real impact on people. If you remember the graph I showed you at the beginning, here is the updated version, where you can see that premature death from cardiovascular disease is no longer falling. On the contrary, it's starting to edge back up. This must be a wake-up call for all of us. We have a duty to fight this trend, to become re-energized and refocused advocates, to flag inequalities and ensure prevention and treatment of cardiovascular disease is available to the largest possible number of people. We, in our countries and with the ESC, can make a difference. Together with our patients, we have a duty to be unrelenting in our calls towards a greater investment in cardiovascular disease and a renewed focus on drug development, innovation, and implementation. We need to work together to have real impact. Let's not forget that it is our duty also to inspire young generation to engage in cardiovascular research and to excel. We, more than anyone, know what can be achieved in the battle against cardiovascular disease. We, as a community, have a track record on which to build. We have been successful. The ESC is passionate about supporting the education and inspiration of younger male and female cardiologists and scientists. Just join us in encouraging young trainees to fulfill their potential, to aim high. And there has never been a better time to be a researcher. Progress has not only blurred the boundaries between basic and clinical research, but also between medicine and physical sciences, genomics and drug discovery, deep learning and clinical practice. The opportunities at our disposal are now extraordinary. In fact, we already live in an era of our imagination, and as a community, we are on our prime. To quote Martin Luther King, our lives begin to end the day we become silent on things that matter. We owe it to our patients not to be silent. We owe it to ourselves to pursue what we know to be right. And there is too much at stake otherwise. The ESC is committed to making cardiovascular disease a greater global priority. And as a measure of this commitment, this year we have partnered with the World Heart Federation to hold this Congress, and the theme of which is global cardiovascular health. So allow me to introduce my friend and distinguished colleague, the President of the WHF, Professor Karen Sliwa. Karen.
Thank you, Barbara. On behalf of everyone at the World Heart Federation, let me say how proud we are to join forces with the ESC in hosting this remarkable Congress. And on a personal note, it is a great pleasure for me to work so closely with you, Barbara. I suspect there are many of you here right now that are asking yourselves the same question. What is exactly the World Heart Federation? The World Heart Federation is a global representative body of the cardiovascular community. We work hand in hand with national and continental societies and foundations, including the European Society of Cardiology. We advocate on those issues of importance to those communities, as well as to patients groups and charitable organizations the world over. The World Heart Federation has an official relationship with the World Health Organization, and this gives us a unique opportunity to comment on the main documents, deliver statements at the World Health Organization General Assembly, and to work closely on specific work plans. We are a respected voice, but at the end of the day, we are only as strong as our members and partners. We believe in a world where heart health is for everyone is a fundamental human right and is a vital element of global justice. This is especially crucial in low-resource settings, which can be found in every country and in every part of the world. No matter where we live or where we practice, we are more interconnected than ever before. Just look around you at this Congress. There are more than 150 nationalities and countless professional backgrounds represented. And all of you have a place in this global health effort. Global health, after all, is the understanding of disease, prevention and management in an international and interdisciplinary context. It's placing a priority on health equity for all people. On a personal note, as a German national growing up abroad and living for almost 3 decades in southern Africa, I've seen firsthand how important it is to advance healthcare without regards to boundaries. Even countries with a relatively low domestic product, such as Rwanda, Ghana, and Uganda, have been able to improve access to healthcare over the last decade to provide ever health equity to their citizens. They've shown us that small step in the right direction can make a huge difference. For example, simple forms of screening for cardiovascular disease is now commonly done by community workers. Getting healthcare workers to both share tasks and shift tasks is now common in communities lacking a sufficient numbers of doctors and nurses. The World Heart Federation is especially focused on conditions that are affecting the poor, such as rheumatic heart disease and Chagas disease. We are also taking the load in tackling other global threats to cardiovascular health. Air pollution, for example, is of particular concern. Its impacts on cardiovascular disease is massive. Every year, air pollution alone causes 1.4 million stroke deaths and 2.4 million heart disease deaths globally. The World Health Organization estimates that 9 out of 10 people breathe polluted air right now and live in places where the air quality exceeds the WHO guideline limits. So what can we do? The World Heart Federation is advocating for 3 main objectives. First, more research into air pollution and cardiovascular disease. We as a scientific community need to provide stronger evidence on the link between those items. Second is to focus on the interconnection between the two conditions. And thirdly, we need to investigate from basic molecular mechanism to epidemiology. We want to see more cardiologists invited to collaborate with senior decision makers on national, regional, and global institutions. We want to make air pollution-related heart disease a priority, to promote healthy cities and more people walking or bicycling. Finally, we are raising awareness on these issues through World Heart Day. World Heart Day is organized every year at the 29th of September with a reach of last year of over 1.6 billion people. We as healthcare providers are potential champions to better access to and management of cardiovascular medicine. We know how to treat heart disease, but we cannot shy away from addressing its root causes, which are often complex. As doctors, we are uniquely placed to advocate on behalf of our patient. Throughout this Congress, you will have the opportunity to engage with these issues ranging from prevention to state-of-the-art treatments. By exchanging information and strategies at events like this, we are already taking the first step to creating a world in which heart health is a fundamental human right. Let's walk us the road together.
Right here. So I hope you're looking forward to this Congress as much as we do. It's a fantastic event, and now you're going to have a preview from the two chairs of the program committee, Silvia Priori and Marco Roffi. Please, Silvia and Marco.
Ladies and gentlemen, dear colleagues, welcome to Paris and to the Congress of the European Society of Cardiology, the world's largest conference in cardiovascular medicine. As you have heard, the spotlight of the Congress this year is global cardiovascular health. This title reflects the focus of the European Society of Cardiology to share knowledge amongst colleagues from all over the world and to promote cardiovascular health worldwide. In many ways, the word global perfectly matches the spirit of our society. Over the years, in fact, the ESC has widened its reach and is now partnering around the world with over 100 societies. Just at this Congress, we are welcoming delegates from more than 150 countries. This year in particularly, we are proud to have a new record in the geographic distribution of abstract submissions. It's the participation of our members that we value most. As you can see, Japan, Russia, and United States are now amongst the top 5 submitting countries. Importantly, the ESC is also a global forum for the dissemination of excellence and innovation. You will therefore be able to hear at the Congress this year groundbreaking basic, translational, and clinical science originating globally from all over the world. This year, as you have heard, we have the privilege at the ESC to partner with the World Heart Federation. Together, we want to bring you 5 days of exciting cardiovascular science. With 4,500 accepted abstracts and more than 5,000 speakers, we will cover 14 tracks, and we will have sessions dedicated to innovative solution, integration of multidisciplinary topics, big data, and large observational studies. A part that is always very attractive of our Congress are the hotlines and late-breaking sessions, and we will have 22 of these special sessions this year for you. The ESC is committed to help our community turn bright ideas into better health, and are your ideas that count. Accordingly, our program on digital health is stronger than ever, with both scientific session and session devoted to the presentation of new technology that will be shown to you. Every day in the plaza, you will be able to meet organizations that are eager to fund your research and investors waiting to hear your ideas and to support them. During the Congress, you will have the opportunity to attend a presentation on 5 new guidelines covering management of key conditions like supraventricular tachycardias, chronic coronary syndromes, diabetes, dyslipidemia, and acute pulmonary embolism. In this guideline, you will hear important changes of high clinical relevance that will be presented for each of the topics covered by the new guidelines. Finally, in your agenda, remember to put a mark and attend the ESC named lectures and the 3 distinguished keynote lectures delivered by inspirational scientists and inspirational clinicians. You will also be able to meet the 3 ESC gold medalists on the ESC TV stage. I do hope, together with Marco Roffi, that this Congress will motivate and give you energy for the year to come. And now, I would like to introduce Marco Roffi, who will highlight some of the other key sessions we have in store for you at the ESC Congress 2019. Ladies and gentlemen, Marco Roffi.
Thank you, Silvia. Ladies and gentlemen, Silvia and I are supposed to guide you through this huge program in just 10 minutes. Wow, what a challenge. Well, let's fasten your seatbelts. Let's take off first to high-flying hotlines. This year has been amazing, both in terms of quality and quantity of trials submitted. I will mention just few, all large and randomized, and with the potential of changing practice. Several of them will be published simultaneously in major journals. In heart failure, Paragon-HF tested sacubitril/valsartan versus valsartan alone in patients with preserved ejection fraction. DAPA-HF investigated the SGLT2 inhibitor dapagliflozin in individuals, both diabetic and non-diabetics, with reduced ejection fraction. A lot of excitement also in the field of antithrombotic treatment. THEMIS tested aspirin plus ticagrelor versus aspirin alone in diabetic patients with coronary disease. ISA-REACT-5 compared ticagrelor and prasugrel in acute coronary syndromes. And FIRE as well as ENTRUST-AF-PCI addressed the combination of anticoagulation and antiplatelet agents in atrial fibrillation patients with coronary disease. Major trials in acute coronary syndrome will be presented. Among them, the high-sensitivity cardiac troponin trials, historic and rapid TNT. We will have trial on oxygen therapy, on complete revascularization in STEMI and multivessel coronary disease patient, the complete study, as well as on remote ischemic conditioning in primary PCI. More and more, genetics is impacting clinical trials. At the meeting, Popular Genetics will address genotype-guided P2Y12 inhibition in STEMI patients, and a naturally randomized clinical trial from the UK Biobank will estimate the clinical benefit of prolonged exposure to the combination of lower LDL and lower systolic blood pressure on lifetime and cardiovascular risk. In the prevention area, do not miss 2 community cluster randomized trials on cardiovascular risk factor control, HOPE4, and on the effect of SALT substitution on blood pressure reduction and hypertension incidence. We are fortunate to have excellent trial updates, including the 2-year follow-up of MITRA-FR on percutaneous versus surgical treatment of secondary mitral regurgitation. We will have the 10-year follow-up of the SYNTAX study, randomizing patients to PCI versus CABG, and even the 16-year follow-up of DYNAMIC-2 on fibrinolytic therapy versus primary PCI in STEMI. High-quality registry will be released from the SWEETHEART on secondary prevention post-CABG and from SWEET-HF on ICD in a contemporary setting. The PURE investigators will present 2 novel analyses. These are just for starters to give you a taste of the late-breaking science in store for you in the coming days. Are you getting thrilled? Let's continue the ride. New features this year include the blockbuster from the young, session comprising the best abstract from young presenters and the controversies in cardiovascular medicine, a track focused on hot topic debates. New dedicated areas will be available for clinical case presentation, the case corners. Multiple activities have been expanded, such as the basic and translational science, the digital health, and the ESC Plaza programs. Do not worry, the core of the meeting is not changing. And on the slide, you will recognize some of the features you have appreciated in previous years, such as Cardiology in 4 days, a track providing a refresher in all the most important aspects of clinical care. We really encourage you to stay until Wednesday and to attend the very popular Congress Condensed and ESC Congress Highlight session. Don't forget to take advantage of the ESC app. And as you will not be able to attend all the session, go anytime to ESC 365 to have access to any ESC presentation. The Congress lives on all year long. This year, this edition of the ESC Congress would have not been possible without a group of over 80 highly committed colleagues and friends of the program committee and a fantastic ESC staff. Silvia and I are very grateful to all of them. Ladies and gentlemen, we hope that you have enjoyed the ride. Get ready to experience this and also this, hopefully. Above all, let's not miss the fantastic opportunity the meeting is giving us to build bridges among people in this world more and more divided. We are all here because we are passionate about cardiovascular medicine, patient care, and science. What a strong bond. Enjoy the Congress.
Thank you so much, Silvia and Marco. That was really a great ride. So every year the ESC meeting is always held in a fantastic, beautiful, dynamic city in Europe. And this year we're back in Paris. So just as we have created this exciting scientific program for you, for the Congress, we have also launched a public awareness campaign for the people of Paris, one that emphasizes the importance of detecting, preventing, fighting cardiovascular disease, and all whilst having a lot of fun. So the event will be held at the Esplanade of the Paris City Hall today and tomorrow. So last year in Munich, the event attracted more than 10,000 visitors, and we hope that we will have even more here in Paris. So we don't lose an opportunity to advocate against cardiovascular disease. And we like to really to thank our local partners and sponsor for joining the ESC to make this event happen. Thank you so much. Thank you. So, as cardiologists, we know the importance of rhythm and how it can tell us more than words sometimes. So let's take a few minutes to listen to the rhythm from around the world, from India, from Africa, and from South America, 3 internationally renowned percussionists.
Eén, twee, drie, vier. Eén, twee, drie, vier. Eén, twee, drie, vier. Eén, twee, drie, vier. Eén, twee, drie, vier.
Thank you so much. That was fantastic. I'm amazed you're still sitting. Let's thank again this fantastic musician. Bravi! So now we are on something really serious. As the ESC in the Congress, we really have the privilege of honoring individuals who have made an extraordinary contribution to our field. They are trailblazers, they are advocates and mentors, they are courageous, they are an inspiration to us all. Our first gold medalist for 2019 is a cardiologist and a scientist who has dedicated her career to discovering the causes of inherited heart disease, such as hypertrophic and dilated cardiomyopathy and congenital heart disease. She was the first to do so, and she still leads the way, both in fundamental discovery and in translating her finding into better diagnostics and improved management for these patients. Dear colleagues, I'm delighted to announce Dr. Christine Seidman, the Thomas W. Smith Professor of Medicine at Harvard University, as our first 2019 gold medalist.
When I was in training, I was really fascinated by physical examinations of patients with heart disease. The heart has sounds or murmurs, and so as you were doing your examination, it was almost as if the organ was singing to you with hints and clues about what had gone awry. So I very much enjoyed the physical examination part of cardiology, as well as the type of diseases that affected the heart muscle became really fascinating to me, and so that led to a field of cardiovascular sciences. Many fields capitalize on removal of tissues because of a malignancy, and that allows cells to be isolated and to be able to study in a dish. But that over the past 10 years has changed enormously, because with the advent of human pluripotent stem cells, we can now manipulate them so that we can make beating cardiomyocytes in a dish and have access to really where the focus of our investigations are. Science is a vast area and a discipline that no one can master in its entirety. But by working together with individuals who have complementary skills and ideas, one can, I think, make more progress, considerably more progress than you can alone. So I think the biggest thing that I've learned over my career is collaboration is not only far more productive than single solitary science, but it's also a whole lot more fun. I think the future is really going to come from whole genome sequencing and in knowledge of what the variance in all of us means in terms of our health today and our health in the future. And over time, as we really begin to understand the complexities of DNA sequences, I think we'll have the opportunity to see those individuals who are at risk for disease before they even manifest the clinical signs and symptoms of any condition, including heart disease. In short, what I'm saying is prevention is going to be, I think, the future of cardiovascular science, and it's going to really improve long-term outcomes.
Fantastic. Christine, please come up. My pleasure to give the gold medal for the society. You can wear it. It has a ribbon. Oh, we'll take a picture with it. If you want to say a few words.
I want to only take a few minutes to thank Madam President. I had to call her that. And the selection committee, and most importantly, all of you. Our work is really a collaboration with many in the audience, so many trainees who are in the lab today, those who have graduated and are now leading independent careers, innumerable patients who have dedicated their tissues, their efforts, and their hopes on our work, and especially for the funders who have had the willingness to support some wild and crazy ideas over time. I thank you for this incredible honor, not for me, but really for the whole team of cardiovascular geneticists. Thank you so much.
Thank you. Our next gold medalist discovered and developed the first cardiac-specific troponin assay, a discovery that has changed our understanding of myocardial injury and the definition of myocardial infarction. Vision, dedication, and persistence have allowed him to translate an initial laboratory finding into a diagnostic biomarker that has impacted the life of millions of patients. So, dear colleagues, I'm delighted to announce Professor Hugo Katus, Chair of Cardiology and Chief of Internal Medicine at the University of Heidelberg, as our next 2019 gold medalist.
Even as a medical student, I was quite impressed by the heart. I was impressed by the intimate connection of life and emotions with cardiac function. Realizing that cardiology, in contrast to many other professions, can really help the patient very rapidly, and what you do is rapidly visible also. That interaction with the patient and the art of cardiology, if you want so, that was very fascinating. I think what our work with troponin is the part which we are most proud of, since it was a long journey. It started in 1978 and it took us 20 years really to bring that to market and to clinical care. Troponin is high-tech, so if you may say it's a test strip, but it's also high chemistry and it's also analytical stability, and it's the significance to it is that it's not only high sensitivity, but it's also its precision. I believe that the next step is more precision in cardiology. And we now have the technologies. We have whole genome sequencing, we have epigenome sequencing, we can do pathway analysis and network construction, we can do precise phenotyping by MRI, by CT, and we have so many data generated, and we have now the tools to analyze all this data. And so our strategy here in Heidelberg is we build for the future in precision in cardiology. I'm honestly very convinced that we will have another dimension of treatment which is not only treating adaptive mechanisms of diseases, but treating the causes and dysregulated pathways.
Hugo, please come join me on the stage. What an honor. How wonderful. How wonderful. So, while taking a picture together, I think you should hold your medal.
Oh, I do.
Now, do you want to say a few words?
So, thank you.
I'll hold it for you.
So, if I may also find a few words. Dear Barbara, dear friends and colleagues from the ESC, I'm very proud to receive this distinguished award, and it's a bit emotional as well. So it's a wonderful opportunity for me to thank many people. I want to thank my academic mentors, both have died by now, Wolfgang Kübler, and Edgar Haber. I would like to thank the many co-workers in my group, to name Evangelos Giannitsis, just past pro toto. I would like to thank also our colleagues from Roche with whom we had that joint assay development. And most I would like to thank all the talented and dedicated clinical investigators which work to bring troponin to what it is today. And finally, I have to admit and also thank a bit my family, since it was not so easy always having a guy like me as a husband, and so at the end, again, I would like to thank you and the ESC. Thank you very much.
Thank you. So the next gold medal will be given together with the World Heart Foundation here. And Karen, please come to the stage. So our final gold medal goes to the current Chief Science and Medical Officer of the American Heart Association, an internationally renowned leader in clinical cardiologists. She's been involved in most of the practice changes trials in heart failure.
She's also a great teacher, a mentor, and a powerful advocate, whose dedication resulted in heart failure and transplant cardiology becoming a certified subspecialty in the United States. Dear colleagues, Barbara and I are delighted to announce Dr. Mariell Jessup as the third 2019 gold medalist.
So my goals when I started out was just to feel that I could be the very best doctor. Oftentimes patients would say, "You look too young to be a doctor." I think they were also saying, "You look too female to be a doctor." Now patients never say that to me. I think patients are used to seeing women doctors, but also I'm not young anymore. My role as the Chief Science and Medical Officer is to oversee the science that is used, not only to promote science, such as in our clinical practice guidelines and our scientific statements, but in our nutrition policies and our advocacy. So science must be the foundation of all of that. I think my big break was when I was a fellow at the University of Pennsylvania. I was searching for an aspect of cardiology that captured my soul. And my chief at the time, Mark Josephson, suggested that I go visit Carl Weber. And I began to work with him, and he was incredibly generous to me. There's no question that I had to work really hard. And there's no question that there was some barriers because I was a woman. I think mentorship is invaluable, and in particular for women who are entering the field of cardiology or any field in medicine. I think women are asked to negotiate the difficulties of an academic life, and often they're asked to negotiate the challenges of being a wife and a mother and trying to balance that. And whereas I had great male mentors, there really weren't any women that were role models for me. So I feel really strongly about mentoring women that are coming into cardiology.
Mariell, please come to the stage.
Wait! I was supposed to kiss you, yeah.
I think we need to move in the limelight.
Yeah.
So this is our honor to give you the gold medal of the European Society of Cardiology.
So much. Dear Barbara.
And now I have to take it back.
Okay.
Because
also getting another award, and you can't carry so many awards, so we have to help you. So this is an award from the World Heart Federation.
Oh, how lovely.
Okay, we are helping.
Can we help you? And I'm sure you want to say a few words.
Dear Barbara, Madam President, and dear Karen, Madam President, what a joy it is to say that and to recognize you. I am so extremely grateful for this very meaningful honor. It's been my pleasure and my delight to work alongside you and the ESC and the WHF for our shared mission. And I hope that as much as we were laughing together last night, that we can continue with your hard work to share the joy of what it is to be a cardiologist, a scientist, a teacher, a mentor, a mother, and a friend and colleague. So you've touched my heart. You've made me strong to keep fighting against the enemy, which is heart disease and stroke. And I thank you again most sincerely. Thank you. What should I do with this?
We help you.
I think we go.
I help you now. Come, we go together.
I think I could do this as a full-time job. I love giving. I love it. So I have more in store. The European Society of Cardiology really celebrates its 70th anniversary next year, becoming elderly officially. None of this would have been possible without the talent, commitment, and generosity of so many volunteers. So this year we are introducing a new award for colleagues who have made an outstanding contribution to the life and mission of our society. So the ESC 2019 Silver Medal for Outstanding Contribution is awarded to Professors Karen Sipido, Alan Fraser, Lina Gonçalves, and Alec Vahanian for their work in research, advocacy, and education. May I ask all four of you, please, to come on stage and accept the award. Yes. Thank you so much. This is for you and for years of service to the society. Thank you. Karen, I know you are all already silver medal recipients, but this is a special one. It's to really let you know how much we have appreciated your work and friendship. Alec. Thank you very much for all you have done for the society. Thank you so much. Lina. Thank you very, very much. This is just to say thank you. Okay, we have a photo all together. Yeah. Thank you. Thank you very much.
The World Heart Federation also has his own distinguished awards. This year, the World Heart Foundation Lifetime Achievement Award goes to an outstanding cardiologist who served and led our community, first as the AHA president and subsequently as the World Heart Foundation president. He has contributed to the mission of the WHH for over 20 years. Dr. Sidney Smith, please come to the stage. The World Heart Foundation Advocacy Award in Cardiovascular Health goes to Dr. Rainer Rohr from Panama for achievement in tobacco control at the national, regional and global level. It's my great pleasure to invite Sidney Smith, and also who's here, and Rainer Rohr to join me on the stage and be presented with their awards. That's for you. Congratulations. Congratulations for this really long-standing, dedicated work for WHH. Thank you. Take the cup. And Rainer, also, congratulations.
Thank you so much.
Really very well deserved. Thank you.
Thank you.
Good.
Each year at this time, the European Society of Cardiology highlights a charitable organization working in cardiovascular care. The European Heart for Children is a humanitarian project that helps young people with congenital heart disease. They're building a hospital in Morocco, and once again, we're proud to support this effort this year. Well, you all know that the ESC takes great pride in the achievement and aspiration of the young community. We are committed to helping them in every way possible. But one of the most tangible ways is in the variety of grants we provide. So, dear colleagues, here are the names of the 2019 awardees. Congratulations to all. As you can see, they're all already reaching for the stars. And now is the time to officially welcome the new fellows of the ESC. We know the time and effort you have dedicated to your profession to reach this point, and we salute you and look forward to your contribution to the life of the society. Here then are the names of the new fellows of the European Society of Cardiology. our new fellow to please stand and dance. And be recognized by your colleagues. Please stand. And now, it gives us immense pleasure to declare the ESC Congress 2019, together with the World Congress of Cardiology, our Congress, officially open. And we invite you, thanks, to join us at the ESC Professional Members Lounge for a cocktail reception right now.
And just follow the musicians at the back of the room. They will lead you to the lounge. See you there.
Thank you.
Thank you.
Thank you.